You know, everything has to have a pill. It has a pill. Well, this is a pill right here. This is medication.
So food to us is like medicine. We have been working with people in our community to educate ourselves about where to get the right foods. What got us talking about food was the realization that as we get older, we're starting to see a lot of illnesses. And with that, we actually saw some deaths in our community, and those were tied to things like high blood pressure, diabetes, and heart problems.
Food prices is one of the barriers stopping a lot of our community members from accessing healthy, nutritious food. So we wanted people to know the basics of what needs to go on their plate. We learned how to read food labels. We learned that for a meal to be good, it doesn't have to be expensive.
They wanted food that was culturally relevant to them, food that they were used to eating back home. How could we grow that together? How could we access it? That morphed into community gardens and, growing your own kale, growing your own pumpkin leaves, growing your own sweet potato leaves. It just creates community, even coming out here and learning, oh, you eat this, or you actually grow this, because it's not just the Zambian community that comes out here. You have the entire African community.
And just the joy of, you're working in the garden and producing your own food. How could you want to miss out on that? It's just beautiful. It's like magic. Very therapeutic.
If you're not eating well, it's going to affect your work. If you're not working, it's going to affect your income. If you don't have income, you don't have a home to live, and you don't have anywhere to go. So when we're talking about all these things and how they are interconnected, that gave us an avenue to talk to people about those and letting people know it's okay to come and talk to me about your fears, your personal fears.
People have opened up, talking about their health and well-being. We've had instances where people talked about how they reduce their medication simply by changing their diet and spending more time outside, walking or jogging.
Seeing those changes is really huge. And then seeing the children that we have grown up here also wanting to learn more about their culture and understanding the type of foods that people eat, the values that they have, and then also embracing their culture here. We've seen a lot of transformation in our community, and it also stems from talking about food.